Okay, we're recording now. Hi, everybody. Thanks for joining. I know some of you are really busy, and I appreciate your joining in today and learning from me. Hey, Adrienne, welcome.
Hi.
Hi, I'm going to mute you too, I'm going to go over the highlights from last week's third Annual Essential Oils Symposium for medical professionals. So get your paper and pens out and get ready to take some notes. And I'm going to share my screen in a few minutes because I was able to get all of the slides from almost all of the presenters. So that's really cool. And now I've muted everybody and I'm recording because there are a few people that really want this information. They've reached out to me, so I'm going to get that to them as well. I was so humbled and honored to be part of this group last weekend. I've attended all three Essential Oils Symposium for medical professionals now. And this one was given at doTERRA headquarters last weekend. There were about 60 medical professionals in attendance, and the collective wisdom in the group in the room was pretty amazing. So they had the PhDs present in the morning and the MDs present in the afternoon. So I'm going to attempt to summarize about 6 hours of information and about 250 slides in about an hour. So we're going to go fast and furious here. And like I said, if you've got questions, just save them until the end. I just wanted to just highlight a few of the take-home messages that I got from this. The first one is that really nobody else is doing what doTERRA is doing as far as research and science goes with essential oils. This is a huge endeavor and a huge commitment to science and research. It's not easy, and many people are unwilling or unable to do it. When we use essential oils as medicine, purity and consistency is key. You cannot do research without a consistent product. The research needs to be reproducible and credible. So this is just the beginning of a new/old era with plant-based medicine, because essential oils really work and the body of evidence is getting hard to ignore. What I mean by new/old is that, less than 100 years ago, we used plants as medicine all the time, and in many cultures and countries, it's still being used that way. So we're getting back to an era where we're getting back to more natural things rather than a lot of synthetic components that have a lot of side effects. As we know, all you have to do is watch TV right now and you'll see a ton of commercials with lots of pharmaceuticals, and then the side effects part of the commercial is almost longer than the actual message in the commercial. So that being said, I'm going to share my screen right now with you, and we are going to get on here. So I'm pretty sure you can see my screen right now. Just send me a message if you can't. But the first lecture is by Dr. Cody Beaumont, and he's a PhD. He's the Senior Director of Research and Quality Control at doTERRA, and his lecture is basically what we just highlighted. Purity, potency, and quality of essential oils is just key. All three of these things go hand in hand. You can't have one without the others. So what does that mean to you? Here's a quick definition of purity. Basically, extracted from a botanical variety with nothing added and nothing taken away. Sounds simple, but a lot of companies and products are not like that, right? We know that. And then potency. We've got to have something that works. We need to have something that is in the right concentration, in the right ratios. Consistency in chemistry is very hard to achieve, so it goes way beyond just the GCMS. And don't assume that just because an oil has been tested that it's a quality product. So there's a lot of companies out there mimicking or trying to mimic what doTERRA is doing, and they're saying, hey, we do GCMS testing on our stuff, but it doesn't really mean anything unless we know that we've got a high quality product. So what is quality? So we're really trying to get deeper into this issue. And we know all about doTERRA's CPTG process. And it's a 3-step process, and there's a lot of science and testing that goes into it throughout when we get the initial material to where it's in the bottle to us. So it's a complicated process. It's not easy to do, and it's expensive. But doTERRA, as you know, is committed to the utmost quality and purity, and I really appreciate that as a physician. I really appreciate that for myself and my family, but also to help other people, because we want to do no harm. That's the first thing. So we're looking at different markers, synthetic markers and biomarkers. So a lot of oils will have minor components in them, which are also very important. And it's a way to tell if an oil is really the real deal or not. And I'm not going to go through a ton of chemistry. So you can see I'm going to slide through these slides, a ton of biochemistry, which is my thing, but we're not going to go through all of this in great detail. But we know a lot about how these compounds work, how the chemistry is supposed to be, what real peppermint is supposed to look like, what real lavender is supposed to look like. So I want to look at this new way that the scientists in doTERRA are looking at components of oil. So it's not even just GCMS and the individual spikes and components, but now we're talking about ratios. So we're talking about ratios of one biochemical constituent versus another, and this is really how we're going to identify if an oil has the right ratios of things. So this is called an arc plot. So, you know, an ideal oil is going to have certain constituents in it falling in the right range. And then you can look at an oil and you can see, is that really a good oil or not? So also when we're looking at, here's an example of lavender, we've got our linalool, we've got our linalool acetate. So this is our GCMS. But then we're looking at the arc plot as well. So it's really giving us another dimension of quality, purity, and efficacy. So understanding plant biosynthesis, climate and soil conditions, variations within species. It's very difficult. There's a lot of factors to control. When we're looking at a synthetic isolate, you know, one chemical component in a pharmaceutical, it's much easier to control things because there's not all of these variables. So it's very important what they're doing here today. So these are new ways of assessing components of oils and basically biomapping the oils to establish ideal concentrations. And that's what that arc plot chemistry is so important. So, you know, like I said, because these oils are not one chemical, we have what we call the whole oil effect. So the major and minor constituents are working together. They're working synergistically together, and you're getting the whole package. So you're kind of getting like the whole football team and not just the quarterback. That's the way I kind of look at it. This phenomenon is also known as the entourage effect in the world of cannabis medicine. So once we have a consistent product, we can start in analyzing pharmacokinetics and pharmacodynamics. So what are pharmacokinetics? Pharmacokinetics is how the body treats a compound of interest, and pharmacodynamics is basically the response of the body. So the scientists at doTERRA and their partners are really trying to develop protocols and designs for clinical research to establish how these drugs are metabolized and establish doses. So we look at the half-life of an oil, how long it lasts before it's degraded down. So usually when we're dosing a medicine, it's about 3 to 4 half-lives. We're looking at bioavailability. That means the ability of the body to absorb and use the components in the oils. Then we could look at dose escalation and assess clinical response. So for example, like they were doing lots of studies on turmeric, copaiba, lavender, and they're looking at how the half-lives go for these oils. And then the turmeric dual chamber cap, which is actually very interesting because the two components, the fat soluble and the water soluble, work together and actually increase the bioavailability. So 91% increase, or 11 times increase in the bioavailability of the curcumin, which is the powdered part. So most people that are buying just regular capsules of curcumin, which is the water soluble part of the oil, are not getting that much of it because it's really hard to absorb and get a good bioavailability. So this is really special about the turmeric dual caps because we're getting the fat soluble and the water soluble components in one unique supplement. When we're talking about half-lives, we found that the half-life of copaiba is about 7 hours, as you can see over here. So we can dose that once a day, whereas the half-life of lavender is really short. It's 1 hour. So you need to dose your lavender if you need it. You need to repeat it every 3 to 4 hours. So once again, this goes to the fact that I always say Mother Nature doesn't make 24-hour essential oils. We need to use them often, use small amounts, and use them consistently. And when you need to use more, you need to use more, right? So there's a lot of bad research out there that can't be reproduced. So what we need to do is we need to do all of these processes and validate and repeat to get evidence-based therapy that we can use in the clinical setting. And that's where, that's the proof of the pudding, really. That's where doTERRA is going to shine because they're really putting the effort into this process. And like I said, it's very complicated. It is not easy. So this is the last slide of this presentation, Keep Calm and Do Science. I thought that was pretty cute because I'm a science geek. All right, so our second lecture was given by Dr. Casey Sayer. He's the assistant professor of pharmacological sciences at Roseman University. And you know that Roseman has been our partner for about a year, and they're doing a lot of cutting edge research, a lot of bench research. So they are really looking at safety and efficacy of essential oils in human clinical trials as well as in vitro. So in vitro is with cells, and human trials are with like real people, which is a lot more complicated. So when we're talking about safety, what is safety? Safety is defined as the absence of serious risk to health, right? And as you know, when we're dealing with pharmaceutical drugs, there is a much higher probability of adverse reactions that can be quite serious. So we want to use human data. We want to do clinical trials. So I'm going to skip over down to this slide. I'm just going to go over this real quickly. They're talking about when we're dealing with humans, we've got lots of different factors that we have to put into consideration. doTERRA is working on a couple of studies right now with 2 enteric-coated soft gels, one with cinnamon bark in it, and one with a combination of cumin, turmeric, and Melissa essential oil blend. So I'm going to skip all the way down to this slide. Okay, so here's the first trial using some cinnamon bark in an enteric-coated capsule. So it's about 4 drops of cinnamon bark, and this is a delayed release capsule, which is good because we have less GI discomfort. And they did a lot of safety and tolerability testing. So you can see that in our humans that they were testing, they did multiple blood draws at multiple times to get a lot of specific information. And then they analyzed a lot of factors and people's blood work. And the take-home message of all of this is basically that there were no adverse effects documented, no significant changes in labs. The only thing that some people noticed was that they burped up a little bit of cinnamon for a couple of hours after administration, which I don't necessarily think that's a bad thing. I think cinnamon tastes pretty good. And that was the only, like, quote unquote side effect or comment that people made. So, you know, the conclusion is that we've got to do clinical safety research. They did that first clinical trial. They're showing that there is a lack of harm, and which is a lot better than most pharmaceutical research. So that's encouraging. That's exciting. It's not a surprise to me because we kind of know that essential oils in general are very safe. So they're small molecules. They penetrate our cells very readily. And we've evolved with these plants and these substances for centuries and millennia. So our bodies recognize these as something natural. The third lecture I don't have slides for. So the third lecture is Dr. Timothy Lee. And I guess maybe I'll just keep talking if you guys don't mind. I'm not gonna take the share screen off. But Dr. Timothy Lee is a PhD. He's the assistant professor of pharmacology at Roseman University. And his talk was really interesting because it was entitled Rational Combinations of Essential Oils for Obesity Prevention. And we've heard Dr. Lee talk at the last two conventions. He conducts molecular imaging and proteomics, fingerprinting, and they're doing a lot of pharmacological identification of oils and working with the APRC to really hone down and tune in on what an ideal oil should look like. He's also conducting potency assessment of CBD oils, so stay tuned. We're probably going to get some information on that at the next convention. So, you know, basically he went over the epidemic of obesity and type 2 diabetes in the United States. This is not new information. A lot of it has to do with a persistent pro-inflammatory rate in our bodies, having to do with diet and lifestyle and other factors. So they're studying the use of plants to decrease appetite, regulate blood sugar, regulate lipid levels, et cetera, et cetera. And as opposed to synthetic drugs, we know, as I just said, that oils have a lack of adverse side effects. And this is huge in this market. We know that Dr. Hill has reported in general the adverse side effect rate of all essential oils to be much less than 1%. So when we're talking about obesity and dealing with that, it's very complicated research because there is about 6 biochemical signaling pathways for adipogenesis. And adipogenesis is the body forming fat cells. So Dr. Lee and his team are conducting a weight loss trial in humans with a combination of oils that they're calling F1, like Formula One. And the preliminary results are really encouraging. So they found that F1 reduced diet-induced weight gain by 41%. So people that were eating a regular diet versus a lean diet versus a high-fat diet, when they were taking the F1, eating the high-fat diet as compared to people not taking the F1, eating the same high-fat diet, the weight gain was prevented or reduced by 41%. And also they found reduced inflammatory serum biomarkers in those people. in addition to decreased glucose tolerance, decreased liver fat, decreased body fat, and decreased bad cholesterol. So they did all of these blood draws with all of these lab tests and monitored all of that on the small cohort of people. And then Dr. Lee also showed us the results on his experiments on himself. He took 2 capsules of F1 a day and lost about 1 pound a day. And he had a slide with his body fat on it, and it was pretty remarkable. So, of course, we in the audience were all asking him what's in F1, and he wouldn't tell us yet. So stay tuned, because I think, you know, we might have a new weight loss product by next convention. That's going to be really exciting. I kind of wish we knew what was in it now, but we could not pry it out of him. All right, so that being said, we got lecture number 4. So that was given by Dr. Jorgensen, who is an MD, and he practices ENT, which is ear, nose, and throat surgery in Utah. And his topic was the internal topical use of essential oils in an ear, nose, and throat specialty practice. So he kind of talked a little bit about what he does, and he uses a lot of essential oils in his clinical practice, and he's been on the medical board at doTERRA for quite some time. So what are essential oils? Essential oils are, I'm going to skip through here. This is just talking about what he does in his practice here. Scroll, scroll, scroll. And he's part of the advisory board, like I said. What are essential oils? Essential oils are basically the plant's own medicine. That the plants use and produce their essential oils to help them heal from infection and injury. And as I said before, they're small molecules that are able to penetrate our cells as well. They're lipid soluble, they have short half-lives, they act quickly and dissipate quickly, which is a good thing. You don't necessarily want things to linger on. You want them to do their job and then leave. So most pharmaceutical medications are derived from plants. So as Dr. Jorgensen said, using essential oils as medicine is not a stretch. Right? So here's a picture of a willow tree bark, and we know salicylic acid, which is basically aspirin, is from willow tree. It's also in wintergreen, as we know. So the advantages of essential oils are that as opposed to a single delivery system like a pill or an inhaler or something like that, we can use essential oils all 3 ways. We can use them aromatically, topically, and internally in most cases. And then we've also got that entourage effect. It's not just one molecule. It's more than one compound that's balanced by nature. We've got synergy within the components, and it's all packaged together so it works better together. So he was going over some review articles, which I'm gonna skip over, but there are a lot of really good review articles out there. This one is about the anti-inflammatory activities of essential oils. And as we know, inflammation, like I just said from the last lecture, is a big problem in the United States, not only with diabetes and obesity, but with a lot of other chronic conditions, including cancer, which is kind of the ultimate expression of chronic inflammation. And then this slide is just talking a little bit about the different inflammatory pathways that we have in the body. It's pretty complicated stuff. So we have drugs that usually block like one pathway at a time. So aspirin works over here with the cyclooxygenase pathway, ibuprofens. There's other drugs that work through prostaglandins like Singulair and other things. The cool thing about essential oils is that we've got a lot of essential oils that work in different inflammatory pathways, and some of them work in more than one pathway. So this is showing us that limonene actually works in the 5-LOX pathway and the COX pathway. So you're getting like 2 for 1 here. So that's pretty cool. So here we're talking about three oils that they were looking at: limonene, eucalyptol, which is also anti-inflammatory, and that's in eucalyptus, peppermint, and lavender, and aspirin, which is methyl salicylate, but that's also found in wintergreen and our deep blue. So that's really cool. Now, in his ENT practice, he's very big on tea tree because we're dealing with otitis media, which is ear infection, sinusitis. So he talks a lot about how he uses tea tree in his practice, and how tea tree is very antibacterial, and it's very helpful, as we know, with biofilms and things like that. So he went through some studies on using tea tree and staph biofilm eradication. Tea tree is really good for most bacteria except for Pseudomonas, which is sometimes a bacteria that gives us a problem with otitis externa, which is external ear infection. But there are other things to use for that. So sorry, his slides got a little bit muddled here, but basically thinking how we're using essential oils in a clinical setting. And he talks about using essential oils as close as possible to the area of concern. So what does that mean? So we know that we're not going to put essential oils in our ears, in our eyes, in sensitive areas, but we want to put them as close as possible. So say you've got an ear problem and you're going to apply your tea tree with your coconut oil at the tragus, which is that little kind of bump in the front of your ear, and around your earlobe and in the back of your ear. So that's what he means by as close as possible to the area of concern, because they're going to get absorbed through the skin and through the tissues, and you want to take advantage of that concentration gradient. They're going to be most effective at the area of application. This was interesting. This is looking at eucalyptus. And we know our regular eucalyptus is Eucalyptus radiata. And that's in our regular eucalyptus and also in our breathe form. So that Eucalyptus radiata is toxic in high doses. So that's why we don't ingest those two. If you look at the labels on those two oils, it doesn't say for internal use. In fact, you'd have to take a lot of it. You'd have to take 2 to 5 milliliters of that to actually get sick. But you might just feel nauseous, vomiting, tired. So very small doses are generally safe. But doTERRA kind of got around that problem when we made the On Guard, because instead of Eucalyptus radiata, there are about 300 species of eucalyptus. They use Eucalyptus globulus, and Eucalyptus globulus is GRAS certified. That means generally regarded as safe, and On Guard is spelt wrong here. But so the eucalyptus format in the On Guard oil and products is a safe type of eucalyptus to use. So I just wanted to point that out, because that wasn't something that I was really aware of. So that's pretty cool. So getting back to essential oils, basically have anti-biofilm activity, and they generally don't cause a problem of bacterial resistance like antibiotics do, because they leave the cell intact. Resistance is usually caused by cell damage, and most of the oils are working on disrupting the sodium channels and the ion channels on the bacterial wall. So we know that they're antimicrobial, they're antifungal, they work by their anti-biofilm effect. And I'm not going to go through all of this research that he went through, but the take-home message basically is there's a growing body of data that we can't ignore in medical practice, and doTERRA is really leading the way by gathering good research, conducting clinical trials, and developing protocols. At the end of, during one of our breaks, I'm just going to slide through all this stuff real quick. Oh, when we were talking about sinusitis, hold on. I did get a chance to talk to the nurse practitioners at Prime Meridian, and they're doing this now in their clinics. They're developing protocols. They're not able to share them all with us just yet, but they're getting really good results with their patients at Prime Meridian. So that is really cool. I'm really excited for the future of that. Back to sinusitis. This is tea tree, eucalyptus, lemon. Those are the ones that have synergy with each other, and also they can also be used with other antibiotics like tobramycin. When you're dealing with an infection that is really resistant or hard to take care of, you can use oils in conjunction with antibiotics, and the two can work together. So that's kind of cool. So this opens up a whole new area of research. Last year in the Essential Oils Symposium, they were talking about using oils that have anti-cancer properties in conjunction with chemotherapeutic agents for the synergy and the effect, the anti-cancer effects. So this is not a new concept, but it's an exciting one, and I think it has a lot of potential. And as you know, there's a lot of problem with multiply resistant organisms. So we call them superbugs. These are bacteria that are resistant to all types of antibiotics. And since 2012, the pharmaceutical agencies, companies, have only really come up with a couple of antibiotics. They kind of like stop developing new antibiotics. It's either too expensive or they're not interested in it. So we're kind of running out of options. So basically we kind of have to turn to something else. So I'm just going to flip through these slides here. He went through how essential oils have changed his practice, and he shared a sinus rinse with us where we use 1 to 2 drops of lemon and tea tree in a sinus rinse. For adults and kids, he did some oral lemon because most kids don't really want to do a sinus rinse. You can use it before you try antibiotics or with antibiotics or when the antibiotics are not working. Also diffusing On Guard or Breathe, using them topically as well. For earaches, let me see, here we go, earaches, topical lavender, tea tree, peppermint, rosemary. He also has a lot of patient with migraines, so he likes to use peppermint, lavender, frankincense, topically, diffusing lavender, eucalyptus, and Breathe for nighttime cough or postnasal drip. These are not the only things, as we know. There are a number of oils that work with headaches and things like that, but these are the things that he shared with us that he likes to use in his practice. They're simple, they're easy, and they work. So future clinical applications, we talked a little bit about that. Here's some of our doTERRA medical people. They're all awesome. They're all great to learn from. And oh, these are his kids. And basically, you know, the doctor of the future will not treat people with drugs, but cure and prevent disease with nutrition, which includes plants. So that was a really nice lecture from Dr. Jorgensen. And then we have our next lecture, number 5, is given by Dr. Geiger. And he is an anesthesiologist that's practicing in Phoenix, Arizona. And his lecture was Clinical Applications for Essential Oils for Anxiety and Pain. So he uses a lot of essential oils in his anesthesia practice. He actually has protocols for pre and post surgery and administration of anesthesia that he's used successfully for a couple of years. He first presented some of this about 2 years ago in the first EO Symposium that I went to. So we're using evidence-based practices and therapies, and oils are improving outcomes and patient satisfaction. We went over some case studies. He is a big fan of ginger and peppermint, especially for nausea related to anesthesia and pain. He has a lot of people with anxiety about surgery, pre-post surgery, a lot of people with pain issues. So we know that essential oils affect the autonomic nervous system, both the sympathetic and the parasympathetic pathways. And I'm going to get over here. Here's the autonomic nervous system, and how we administer just by the sense of smell, just using a little cotton, breathing it in, and helping us with those things aromatically. So here's some properties and applications of essential oils, some general things that, essential oils are in many foods and food products that we eat already. So 30 parts per million in many food products, and about 60 milligrams a drop. There's different viscosities and things. And they're very low caloric and zero glycemic index. So we've got zero calories and zero sugar in the oil. So that's kind of cool. And when we're talking about ORAC values, that has to do with a measure of the antioxidant abilities of oils and their ability to scavenge free radicals, which is really important for cellular health and reducing inflammation. So we're going beyond these parameters, though. We also know that oils can intervene and influence our HPA axis, our hormonal axes, and binds to many different kinds of receptors in our body, modifying gene expression, biomarkers, DNA transcription and translation, and also having anticholinesterase activity in the brain, which is important in anesthesia, but also important in declining brain function and Alzheimer's disease, et cetera, et cetera. And he's a big fan of how essential oils influence the voltage-related channels, the sodium and calcium channels in nerve axon potentials. And there's tons of studies out there. So I'm going to slide through this because he like went through, it was like an incredible amount of studies, kind of mind-blowing stuff going on about all different types of topics. Here's the GABA synapse, which is important in pain and anxiety, neurotransmitter synthesis in the brain, and anesthesia and medical-based aromatherapy, evidence-based pathways. And then I gotta really slide through all this because there's so much research that he presented. It was like boom, 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 mind-blowing stuff. So I'm going to go conclude with this and slide through all these slides here because it's just a lot. Just know that there's a lot of good research out there in addition to a lot of bad research, and you kind of have to sift through all of it. So the next lecture, number 6, when I get through all these slides here, whoa. Hold on one second. Oh, and that's how we ended. Where there are essential oils, there will always be hope. That's fun. Yay. Okay, so Dr. Go is an ER doctor in South Dakota. He was doing some case studies for Copaiba. So this is basically just talking about how he uses Copaiba in his practice with different patients. So he presented some of this at convention. So this is just sort of anecdotal. These are his experiences with Copaiba. I say Copaiba, some people say Copaiba. I think either way is okay. So we're talking about different patients and basically talking about, abnormal health is not normal. You shouldn't really just say, oh, this is my new normal. I've got chronic pain in my hands. I've got arthritis. What kinds of things can we do to either slow down or reverse this process, right? So his case number 1 was a woman called Gloria, who was a 57-year-old hairdresser who had arthritis in her hands. So these were the protocols that he used for her, using 2 to 3 drops of Copaiba in with the deep blue rub, putting it on her hands twice a day, and then taking 1 Copaiba soft gel. So instead of 3 drops internally, now we've got the soft gel. So she kind of moved on to that. Case number 2 was a 51-year-old male named Tim with COPD. He's on all of these inhalers and all this nasty stuff to help him breathe. And, you know, he thought that this was his new normal, and then he wasn't going to get much better than that. So, so Dr. Go put him on this protocol of using 2 to 3 drops of Copaiba Breathe and green mandarin in a diffuser during the day, and then using Copaiba Breathe, On Guard, and Serenity in a diffuser at nighttime. And then he also had him do a nasal rinse with Copaiba, 1 drop at bedtime, and then also using this topical roller ball with 10 drops each of Copaiba Breathe and green mandarin with fractionated coconut oil, putting that on his chest, putting it on his hands, and taking some deep breaths. And that really helped his quality of life a lot. Case number 3 is a young girl. She's 10 years old with a seizure disorder on carbamazepine, which is Tegretol, which has some not so nice side effects. And her mom just felt really helpless whenever she had a seizure. So this was Melanie's protocol that he put her on. So we got 10 drops each of Copaiba Balance and Lavender plus 4 drops of vetiver in a 10 ml roller. Put it over the head, the back of the neck, and on the hands. Sorry about these typos. These are not my slides. For inhalation. And long story short, she'd been episode free now for 2 years, and that was not her normal. She was having seizures much more frequently than that. So that's pretty cool and makes child and mom very happy. Yay. Ian, case number 4, he is a 38-year-old guy with chronic low back pain. He's on some opioids and Norco and Flexeril and Valium and all this stuff. And he does do yoga. We were talking about the opioid crisis real quick. As you know, opiates are a leading cause of deaths and morbidity and mortality in the United States. It's a big problem. Tylenol is also very dangerous. It's very liver toxic. There are some people that are taking way too much Tylenol, and if you destroy your liver and you have liver failure, you basically need a liver transplant or you die. So that's bad too. So what did he do for Ian? So once again, we got our Copaiba, using it internally morning and night. So he now uses the soft gels morning and night because that's just way easier to do. He's made a lifestyle change with his yoga, and he's also using Copaiba topically with Deep Blue and Aroma Touch as well. So that's another win for essential oils. Yay. And last but not least, we've got 34-year-old male with military guy with herniated discs, anxiety, depression, PTSD. He is on some pretty heavy duty medications, morphine, tramadol, and a bunch of NSAIDs that are bad for your liver, bad for your kidneys. So these were all the meds this guy was taking. That's kind of crazy for a young guy. This is polypharmacy here. This is what we're talking about. And, you know, basically resorting to other things that are not good. So he needed to change his life around. So Dr. Go started him on the Lifelong Vitality, the Deep Blue Polyphenol Complex that you can see over here, and the Copaiba. So now, instead of all this stuff, which has a ton of bad side effects, he's on this stuff. So which one would you choose, right? So topically, he was using the Copaiba, the Deep Blue, the Aroma Touch, which is a good combo for back pain and chronic pain. Not the only combination, but a good one to use consistently. So the take-home message is that we do have options, and it's awesome, I think, for me as a physician too, to be able to help people this way. We have options. Okay, we're up to the last one. Thanks for hanging in there, you guys, with me. So Dr. Osguthorpe, I love him. He has been with doTERRA now for about a year, And he is just an awesome addition to doTERRA. He's the Chief Medical Officer of doTERRA and the head of the Prime Meridian Clinics. He's trained in pediatrics and infectious disease, and his lecture was called First Do No Harm, which is kind of one of my mantras as well. You know, I just can't tell somebody to go out and buy any old essential oil in the store, because I know they're contaminated, they're not pure, and they could be harmful. So I'm so happy that I have a consistent product made by this wonderful company. It's just priceless. So he was talking about not only doing no harm physiologically, but also psychologically, you know, not to condescend to our patients, really to be open and listen and honor that sacred relationship between doctor and patient. He was talking about all the different kinds of medicine now: integrative medicine, complementary therapies, alternative medicine, functional medicine, folk medicine, holistic medicine. And then we were talking about a difficult case of a young girl with chronic fatigue and how we would try to help her. I'm going to just kind of slide through this. And then just using different language and offering people other options if they're open to it, by saying, yes, and we can do this too. And be curious if they bring up other things to you, like, oh, I've never heard of that, let me look into it. And then, like I said, just do no harm. So that kind of concludes all of the wonderful talks that we had. And I just want to just talk real quick, a word about compliance. You know, when we're talking to people about some of this information, I just caution you to be careful. If you're not an MD, you cannot give out medical information or advice and be construed as doing so. Even when I talk to people, I say, you know, this is adjunctive to or complementary to your doctor's medical advice. I don't tell people to go off their psych meds or stop their cancer therapy or do any of that. But I know that these things can be additive. They can help and not hurt. And maybe over time, with working with your doctor, you can maybe wean off some of your narcotics or some of your other medicines. So that's kind of a cool thing to be able to offer people. You can cite the published research and point people in the right direction, though. And there's lots of shareable, compliant information. I'm gonna stop sharing my screen right now and just talk to you guys. So there's lots of, as we know, there's lots of shareable, compliant information on the doTERRA website. I love the Discover Solutions because that goes through a system by system approach. I love the Empowered Life series of webinars, and those are all recorded. There's videos, there's podcasts, there's the ebooks. There's so much more. So you just kind of, when you go on doTERRA.com, I just search for things and I kind of look for things and find them. But if you can't find it, just ask me, you know, and if I can't find it, then I ask other people. Like Adrienne is always extremely helpful when I can't find something. So we've got a great team, and we've got an arsenal of information that we can use. So just to conclude, my mission is to empower people with information so they can make informed decisions for themselves and their loved ones. And I really thank you for listening. You know, it's a lot of information to go through, and I tried to keep it, I got it down to an hour here. And now I'm going to unmute you guys and open it up for questions here. Unmute. Okay, what'd you think?
That was
Lisa,
excellent.
thank you so much. That was so good.
Thanks, Adrienne. Yeah, I can do a shorter version, maybe on one of our Wednesday calls.
Yes.
Yeah. So any questions?
No, you got me going though. I'm like, okay, what about the CBD? And then you were talking about the weight loss, and you know, I'm like, okay, now I'm really looking forward to convention next year.
I know. They sort of implied a few exciting things that they're doing, and you know, when they when they came out with the peppermint enteric coated capsules, I was just like, oh, this is just the beginning of a whole new line. I can just see that right now. So that's really, really cool that they're really, you know, making medicine, you know, and they're using different formulations and modes of administration that we use in the pharmaceutical industry, but ours are safe with no side effects.
Love it.
Yay. Anything else?
Do you have any more information, or do you touch base on the lemon and eucalyptus?
What do you mean more information specifically?
Oh, that's a new oil blend, right?
I
They cover-
thought you meant lemon and eucalyptus together, because that's what Dr. Jorgensen was using, because they're kind of antihistamine and you know, helping with the ear, nose, and throat stuff. The lemon eucalyptus itself, I mean, besides what was presented at convention, I don't have a ton more to add. Adrian, I don't know if you've used it really much. I've mostly just been diffusing it.
Yeah, I don't have, I mean, on their website, there's more information, but I've been using it and I can really, I really love the aroma. I think for me, diffusing is one of my favorites, but yeah, I mean, Lisa, you covered a lot too.
Yeah, I mean, I like to diffuse it in my kitchen. It makes it a really clean scent. When I go to tropical places, pretty soon I'm gonna add that to my regimen because it's a powerful insect repellent. And the only other thing I used it for was when my garbage disposal in the kitchen was really stinky. I put some baking soda and I put several drops of lemon eucalyptus down there. And that really took care of the nasty smells in the garbage disposal. But you can clean with it. You can, you know, you can use it like some of your other oils that way.
Thank you.
You're welcome. Anything else?
You covered a lot. I really
I
enjoyed
know.
this past hour.
I might watch, I'm going to be watching the recording again.
Yeah, it was excellent. Thank you so much, Lisa.
Are you welcome? I'm going to stop the recording, but we can still